January 1st, 2027. Mark that date down, because on that day, what happened to me in Georgia is going to start happening to you. Doesn't matter what state you live in. The clock is already running. If you watched my last video, you know that Georgia kicked me off Medicaid in 2023 and has refused to put me back on for 3 years running. The reason is a state program called Pathways. It requires 80 hours of work or qualifying activities every single month to keep your health coverage. I can't do 80 hours of anything. Most disabled people can't. Here's what almost nobody is talking about. There is a federal law called the One Big Beautiful Bill Act. It passed in 2025. It contains a provision that mandates every single state implement a Medicaid work requirement by January of 2027. Every state, not just Georgia. For 3 years, Georgia has been the test case, the lab rat, the state where the federal government and the state government got to find out exactly how a Medicaid work requirement plays out in real life. And the result was about 4,900 people enrolled in Pathways. The state had projected 90,000. They missed by 95%. That's not a failure, not from the state's perspective. That's the program working exactly as designed. Because the goal was never to enroll a lot of people. The goal was to make enrollment so difficult that most people would give up and stop applying. I am one of the people who didn't give up. I have a stack of denial letters thicker than my forearm. And I'm here to tell you what 80 hours a month actually means when you have a disability. It means you have to find a volunteer position that will accept someone who needs a wheelchair, who can't sit upright for more than 3 hours at a stretch, who has unpredictable flares, who can't drive. It means you have to document every minute. It means if your medical condition causes you to miss a single week, you're at risk of losing coverage. 80 hours is 20 hours a week. For a healthy person, that's a part-time job. For a disabled person, that's an impossibility, wearing a costume that says reasonable. And here's the federal twist. The OBBBA framework is actually stricter than Georgia's current version in some ways. The federal version has hard-coded long-term exemptions for foster youth under 26, for fully disabled veterans, and for medically frail individuals. That sounds great, until you read the definition of medically frail, until you find out who decides, until you realize that the same state agency that denied me 12 times is the agency that will be deciding who counts as medically frail in your state. If you live in California, in New York, in Pennsylvania, in Michigan, in Illinois, in any of the 40 states that expanded Medicaid the regular way, you have 8 months. 8 months until your state has to start building out a pathway-style system. And every single state agency is currently looking at Georgia as the blueprint. I want you to understand something. The reason most Americans have not panicked about this yet is because the news has not covered it. The OBBBA passed with 1,000 other provisions in it. The work requirements section got buried. By the time most people figure out what happened, the deadline will already be here. Here is what you can do right now. Find out if your state has started drafting its work requirement plan. Most states are required to submit drafts to CMS for approval before January 2027. Public comment periods are coming. Show up. Submit comments. The disability community in Georgia did not show up early enough, and we are paying for it. Call your governor's office. Call your state Medicaid director. Ask them one question. What is your state's plan to ensure disabled residents are not cut off from coverage when the work requirement takes effect? Document the answer, or document the silence. This is not a Georgia problem anymore. This is a 2027 problem, and it has your state's name on it. Subscribe, share this with anyone in your life on Medicaid, and tell me in the comments what state you're in. I'm tracking which states are moving fastest, and the comments help.